Hello, warriors. Do you feel like you need to be hospitalized for depression, aka major depressive disorder? Wow, this this is a serious one. It's not hard. It's not easy to give an answer, but I think there's a few things you can consider if you are in this horrible position, and if you are, I feel for you. I really do, because I have been there, never been hospitalized, but I asked myself the question two times in my life. I asked myself that question. I think, of course, the first thing to say is, what are your therapists and what is your psychiatrist saying? However, people are not inside of you. People are not you. For example, in my last depressive episode, both my psychiatrist and my therapist were saying that I shouldn't be hospitalized. While now it's just too late to change the past, and I overcame it. But I think I could have benefited from it in a sense, because it took too long to find the medical cure and a solution for the horrible problem that I was experiencing. So I think bottom line is, no one can tell it better than you. So you have to be really, really honest with yourself here and ask yourself these questions. Do you have the resources? Do you have someone to fall back on? Do you have a family? Do you have friends? Do you have a financial structure? It's important, but what's more important is, do you have friends and family that you can count on? Because sometimes you don't need to be hospitalized. You just you can be at someone's house, at your family's house, and people can take care of you. That's okay, as long as there's support. If there's no support, it's really, really, really difficult for you to get better. Question number 2 is this really working for you, and how long? Because if you've been depressed for a month, and you're trying different treatments, and none of them are really working, but it's been a month, so give it a try, give it a couple more weeks, maybe another month or something like that, if you're not like immediately suicidal. Because if you are, then that's also the issue. If you are really suicidal, then you probably have to be again in a place where people check on you all the time. You can't be alone, so either with friends and family all the time, or in a hospital. But is this working for you? How long have you been trying this? And to answer this question, I came across this book. It's really, really cool. It's Darkness Visible by William Styron, and it talks about his depressive episode. And he says that really for him it was when he was hospitalized, actually, that he overcame the depression, which might not be the case for everyone, but I've seen people say this before, that nothing was working until they were in a kind of structure where people would take care of him, quote unquote, but be dedicated to him all the time. What he says is, sometimes when we suffer from depression or manic depression, mixed episodes, you name it, we tried on different medications, and that's kind of what happened to me. I started with Lyrica, which was a medicine for anxiety, because at the beginning people thought I had anxiety, and that didn't work, and I was getting worse and worse and worse. And then I started on lithium, which kind of helped, but not completely. Then I had to take other medications and other medication, but this whole thing took around 4 months. So if I was in a hospital, that's what the author said. If people are in hospital, the doctor can immediately see how are you doing, how are you responding to medication, is it fast enough or not, and they can immediately help you. As opposed to in the real life, you have to book a session with the psychiatrist, and then the psychiatrist might not really know what he's doing, or he might not really, be in a good mood, or he might not be, able to analyze you that day, or, something might happen. Then you go home with a prescription and you try the same thing. And in this process, your brain cells deteriorate. I mean, they of course they regenerate after, but what I want to say is like the depression gets worse and worse and worse. So that's one factor to take into consideration. Finally, the factor is, of course, the final decisive factor is, are you a danger to yourself and others? That's the immediate thing. But so if you know that you're gonna do it right now, right here, kill yourself, then just by all means just go, But sometimes we do have suicidal ideation, and we major part of us don't do it. I know I didn't, and now here. So you have to measure the costs and benefits. What is it going to cost you to go to this institution, and how are you going to benefit from it? Is it going to cost you your job? And is your job worthwhile, for example? Because sometimes it is, as I said, if you have been insanely suicidal for many, many days, and I've been there, I know how it is. It's absolutely excruciating to, like, you wake up feeling like killing yourself, you go to bed thinking like killing yourself, feeling like killing yourself, you spend the day looking for methods to kill yourself, then it's worth losing your job, or is it like you have some suicidal ideation, but you know that you're not really going to do it, and you would benefit more from just simple things like exercise more, get more sunshine, see more people, change your lifestyle, change jobs, etc. In that case, maybe an institution is not going to do anything for you, because you're just going to be stuck in a place, pumped on meds, and probably going to be in contact with people that are maybe not a good influence for you, because maybe they can bring you down. So if you feel like you can overcome it by yourself with diet, exercise, meditation, and psychotherapy, then that's the choice that you have to make as well. I hope this video helped. I know this is not an easy choice, but I think your gut feeling is really important on this one. So ultimately, if you have to go to an institution, I think that this is my experience. Because in my first depressive episode, my psychologist suggested that I would go to a mental institution because I was suicidal, and I told her, no, I'm still going to give it another try. I'm still going to, there's a center here in my city who specializes in suicide, so I'm still going to go to that center and talk to these people, and then if it doesn't work, I'm going to go and be hospitalized. But at that time, there's something inside me that knew that I could overcome it by myself. That was my first one. The last one, I kind of knew that I had to go, but there was a part of me that didn't want to, because it's a tough thing, so I didn't go, which was fine, because I kept working, I maintained my job, so financially I kept, it was a different path. But I think your instinct is really important. Okay, if you have any questions, don't hesitate to contact me on the email below. And I wish that this phase really passes for you. It's a moment, it's going to pass. I know it seems like forever, as major depression does. And when you're feeling suicidal is because you feel like nothing ever is going to get better, but it will. And you will come out of the other side. well. Okay, I wish you happy healings.